Good morning, everyone. I think we're going to get started. It's so nice to see so many of you here. A huge thank you for joining us this morning at Fox Hills. It's such a gorgeous backdrop for a discussion on wellness, and I'm so thrilled that the sun is sort of shining for us. Thank you for being here. We're here this morning really to talk about the power of rejuvenation. After all, women's health is rife with taboo, from facial fillers to female rejuvenation treatments, menopause to sexual health. So really this morning we're going to be talking about how to break down those barriers to a more sort of open, informative discourse, but also how to find the treatments and the solutions that can help at this stage of life. The reason that we set up the Beauty Triangle was very much to educate and empower our audiences, such as yourselves, on all aspects of their health and well-being, and always from a holistic standpoint, which is why you'll always find 3 practitioners on our panels. They're always an absolute expert in their given specialism. And to that extent, it was also our intention to introduce you to these incredible spokespeople in wellness. So that leads me very neatly onto our introduction to today's panel, starting with skin expert and aesthetic doctor, Dr. Aggie Zatonska, former surgeon and body specialist, Dr. Selena Langdon, and finally gynaecologist and BHRT specialist, Ms. Tania Adib. And really they're here this morning to debunk some of the most common misconceptions when it comes to women's health, but also to really advocate a personalised approach to all of the concerns that we might be facing, both inside and also out. Just before we get started, you should have found a programme on your tables. It'll have information about everybody that you'll hear speak here this morning. On the back, there's also a referral card. So if you'd like us to connect you with any of our speakers, just leave your email address, tick the box next to their name, and we'll sort of make that connection for you after the talk. We've got an amazing goodie bag for you with some real treats in there this morning. We've got revision skincare. We have a gorgeous voucher for Atelier Clinic as well with Dr. Aggie. I think that was it, wasn't it? Yes, make sure I haven't missed anything. And we'll also have time for some audience questions at the very end. So if there's anything that you want to ask, please sort of store it away, and we'll make sure that we come to you at the end and get that answered for you. So it's enough from me. I'm going to hand over to our amazing panelists. They're going to say a few words, say a quick hello, and then we'll get started with the main chat. So over to Dr. Aggie. Thank you for being here.
Thank you for having us here. It's lovely here at Fox Hills, and it's lovely to start to talk all things aesthetics.
Thank you. Dr. Aggie is the founder of Atelier in Egham, where you're doing everything pretty much, aren't you?
Yes, so we're not far from here, about 15 minutes, and we offer all treatments, aesthetic treatments, skin analysis. We start this journey with patients from skin analysis and then guide them through the whole process.
It's definitely a journey.
It's definitely a journey. So my patients usually find us looking for guidance, looking for prevention. They do not really seek huge metamorphosis. They just think about how they can preserve themselves, how we can manage our aging process in the most natural way. Just focus on well-being, wellness part of it. I always tell my patients, because they sometimes come with a little bit of anxiety, thinking, oh no, this is not vanity, I just want to take care of myself.
Exactly.
And I feel that this is an act of self-care, that we do take care of our envelope, but it also makes us feel a little bit better inside. So that is all very well connected. Yeah. And I think if we just do it well, respecting our anatomy, that just keeps us looking fresh for longer.
It's a very good point to make. And Dr. Selena Langdon, also joining us this morning. Thank you, Selena, for being here.
Thank you, Francesca. It's lovely to meet everybody. So I have a clinic out in Berkshire. It's called Berkshire Aesthetics. I've been in the sector probably as long as Aggie, I think. And we're quite a body-focused clinic, although we do offer facial aesthetics as well. We like to take a sort of holistic approach, sort of top to toe with every part of a patient that presents to us, but we've sort of become quite focused on body treatments because we found that they're just as popular as facial procedures, and we do see a lot of male patients as well, not just female. And I think, we have a very similar approach, echoing what you said. I think patients come to you with sort of concerns that they have either been thinking about for a number of years, they're worried about it, they want to come and see somebody, have a very sort of open and honest, conversation about their worries, and then have a really sort of discussion where they feel that they have options and choices, and they're not just sort of going to struggle with just surgery as the only kind of route that they can take. Although I am a huge advocate for surgery as well, but I think that you can kind of blend both of them very nicely, and it's popular. Patients do like to come and have procedures like this and treatments, and I think the sector as a whole, it's forever expanding, it's always growing, and I think there are so many new technologies that are coming through all the time. But we like to make sure that we offer everything that's evidence-based, and that we know that it's going to deliver good results for patients. And yeah, it's a really enjoyable field to work in. I like it.
Thank you so much for being here, Selena.
Thank you.
And finally, Tania, thanks for joining us as well.
Thank you for asking me to attend today, Francesca. So I'm a gynaecologist. I started off life as a gynecological oncologist, doing big cancer surgery for ovarian cancers, womb cancer. And then about 8 years ago, I was asked to become a trustee for the Breast Cancer Haven in London. And I learnt all about the side effects that women who have treatment for breast cancer, 80% of which are estrogen driven, that these women really experience some very significant symptoms of the menopause. So even though they are cured of their disease, their quality of life after that is really significantly reduced, especially in terms of vaginal health. So I started looking for solutions for non-hormonal treatments to improve vaginal health. I came across the laser, which is fantastic for dryness. I then diversified my skill, and I now use radiofrequency, PRP, the toner chair, and I've also moved my practice very much to management of the menopause. I run the Lister Menopause Clinic in London, and I help manage the menopause both with hormones and non-hormonal strategies, depending on what women need. We are projected to be living into our 80s and our 90s, potentially half our lives in the menopause. And that has all sorts of impacts on our physical and mental health. And it's really important to optimise our health right at the beginning of that journey, so that when we are 85, 90, that we're still living a really good and healthy life.
It's all about quality of life, isn't it? That longevity.
Absolutely.
Longevity is such a buzzword, but when you sort of understand how female health and menopausal health fits into it, I think it's so relevant. That's fascinating. Half of our life being in the menopause. I'd never heard that before, but really relevant. Thank you so much, all of you. I feel like your approaches are going to overlap so beautifully, and I'm really excited to speak with each of you in turn. But we'll start with Dr. Aggie. So Aggie's introduced herself. She's an amazing aesthetic doctor. She takes a very slow and sustained approach to aesthetics, which doesn't sound exciting, but actually I think it's what people are looking for from their aesthetics, in all honesty. But she also has a very high-tech sort of repertoire of treatments, which we're going to go on to speak about. But I mean, Aggie, you touched a little bit on the sort of things that your patients are looking for from their aesthetic treatments. But what are the sort of key issues you see them facing?
Overload of information, first of all.
Yeah.
We are bombarded with so many different ways of how we can take care of our skin, how we can control or slow down a little bit the aging process. It's overwhelming. So
and it's misinformation sometimes
there's
as
a
well.
lot of misinformation, there's a lot of marketing. So as Selena mentioned, it's we all evidence-based. So it's just to explain first and then guide the patient through the process, depending on where they want to take it, obviously, and where I want to take it as well.
Yeah, because it
have
has
our
to be
own boundaries.
It has to be that hand-in-hand approach as well.
Exactly. So that's just the start of this relationship that develops over the years, and we have more sophisticated technologies to help our patients along this journey. So it's always important to start, explaining what would be the best way to approach the concerns.
And when you're looking at the sort of face and neck, which is your sort of main focus, I suppose, with the aesthetic world, like what are the things that are sort of predominantly bothering the women who are coming to see you?
It's mostly skin health. My patients seek my consultation for a natural result. They don't want to look any different, to be honest. They most of the time, they just want to maintain what they have, the fresher version of what they have. We all sort of happy with how we are. We just want to keep it for a little bit longer. And I think there is a lot of fear, a lot of anxiety. I don't want to look any different. I'm worried about, the outcomes. So I think explaining, educating patients about what's available and how we can do it safely. It's the main start of our conversation.
And certainly the narrative that I'm hearing from more and more doctors is that the whole sort of wanting to look 10, 15 years younger it's sort of dead in the water now, isn't it? It's much more about being the best version of yourself at the age that you're at, and sort of, I suppose, preservation in a sense.
Yes, but also if you think about it, doing too much can actually make people look older. So that's a little bit, I think when we start to explain that there is this fine balance, I think it puts a lot of patients at ease, and then we can, discuss all the other options and what actually is a right choice for this particular patient, for their concern, but also if they have they present with any skin problems, how we can help them along the way.
And so a lot of this goes back to your skin analysis that you do right at the beginning, does it?
Yeah, so we, it's no longer our opinion. We have this very, very clever device that analyzes the skin. That's our baseline, starting point, and then we can decide, what are we more, susceptible to encounter in the future, or what's presenting at the moment, and how we can tweak our journey to.
So this is picking up on things like what sort of fine lines, pigmentation, that sort of thing?
Pigmentation, inflammation, some redness, some deeper pigmentation, some hormonal pigmentation. So we work with many other specialists as well to make sure that we get this particular patient, the best care they can have, and the best outcome they can have. So that's where we start, and then there are so many other options.
The sky's the limit. It's interesting that you said inflammation, because I think that's a huge driver, isn't it, towards sort of aging of the skin, the collagen depletion, or all of the sort of age-related changes that we're seeing within the skin. Is that something that you're sort of really sort of trying to tackle through treatments now?
Absolutely. So we use the energy-based devices. We use light to help with the inflammation, but our newest technologies are exosomes. That's something that's very exciting. It's a bit of a buzzword at the moment, but they are absolutely fascinating, and they do work strongly, anti-inflammatory. So that really helps to control the inflammation.
And can you relay to everyone sort of exactly what exosomes are? Because like you say, they're a real buzzword right now in aesthetics, but there's still sort of a little bit of confusion as to sort of what exactly they are, how they're working, what they're doing.
To simplify it very much, because otherwise it's not very interesting, these are
a whole science lesson.
This is a natural way of how the cells communicate with each other. So the cells in natural environment send a little signaling vesicles to communicate with each other. So this process has been understood a little bit better and hacked. I call it biohacking. It's very interesting how we can now impact the way that those cells communicate with each other.
So we can influence what they're saying to one another.
They look like little shuttle buses, traveling between the cells, delivering the correct information, the signal, so the next cell knows what to do. So they are now packed with active ingredients. They're packed with cytokines, which are very potent anti-inflammatory molecules. They've packed with growth factors, with peptides, with amino acids, with antioxidants, vitamins, etc. So we can now very specifically impact how the cell is working. What do we want the cell to do? If we want to increase collagen elastin formation, we can stimulate this process. It's fascinating.
And so these don't just then have an aesthetic, they obviously do have an aesthetic outcome on the skin, but I suppose they're also addressing sort of the low-lying health conditions that the skin might be going through, things like the inflammation, like you said.
Exactly. So they regulate the inflammation, and but there are various types of exosomes.
Yeah.
And I think it's fascinating. I think it's just the beginning of the journey.
It's really the tip of the iceberg.
Early days, and I think it's just going to get more and more excited. At the moment, we use them to stimulate our collagen, our elastin production. That's a 700% increase of collagen formation
Wow.
and 300% increase in elastin production compared to, for example, normal microneedling. So that's a lot, and we use it. They licensed to use topically, so we use it with microneedling. So we create those little microchannels so the skin can absorb the exosomes.
So you do the microneedling across the face or the
Yeah.
neck, and then you literally apply it
just
as almost like a
infuse.
serum. Yeah,
Yeah, and then
it goes into
infuse
these little
the
holes and
exactly,
waters
and they
feeds
naturally
everything.
spread because that's what they do. They naturally start to spread and travel between the cells, and then that's all our own production, our own native collagen, elastin, not injecting anything that that stays there. It's literally just our own ability to heal, to produce those.
And I feel like there's a huge sort of acceleration towards these therapies where we are doing things in a call it more organic way as well. We are sort of using our body's own abilities to regenerate and almost heal itself. And so that's sort of obviously what the exosomes are doing.
Yeah, absolutely. That's a brilliant way to do that. Obviously, there's still place for other things. We still use a lot of skin boosters, we use a lot of other modalities as well, but that's something that I almost feel like it creates a better environment for my injectables, energy-based devices.
It's almost like you've got the skin into its optimal health, and then you can go in with the sort of more aesthetic, the icing on the cake, as you always refer to it. So what's the difference then between sort of the exosomes and something like a skin booster?
So skin boosters, I refer to skin boosters as hyaluronic acid products because these are the skin boosters that I use, and one of my favorite ones is Profilo, for example. That's hyaluronic acid product. So as we age with time, our own collagen production is decreasing. Hyaluronic acid production is decreasing. So we have less and less of hyaluronic acid. Our own hyaluronic acid doesn't last very long. So skin boosters are a lovely way to inject, because the molecule of hyaluronic acid is really big. So obviously it's in every moisturizer that every one of us is using, but they sit on the surface of the skin. They cannot
The moisturizer sits on the surface.
Yes, they cannot go through to the barrier of the skin unless the molecule is injected. So when we inject skin boosters, they then have this ability to attract water and then also to stimulate collagen. So it's almost like supplementing, injecting something that used to be there, but it's not as much of it anymore. So it is, in a way, a very natural way of replacing what we had in our skin.
And it's really interesting because I think skin boosters, particularly brands like Profilo, they really have sort of found this niche with the patient and the consumer, where even the people who are very hesitant to do injectables, you're saying here that skin boosters are still injected, but for some reason we're much more open to them, wouldn't you say?
It's a supplement, isn't it?
We can phrase it however we want, but I guess it's a supplement, albeit we're injecting it. But what is the difference? Because people are still very adverse to things like toxins, to Botox, to facial fillers, to a lot of injectables. Yet skin boosters seem to have found this corner of the market where people go, oh, it's fine because it's collagen.
Because it's collagen, because it's skin. It's not volume. It doesn't change the way you look.
Exactly.
So I think this is where patients feel a little bit more relaxed about those things and they're not so scared about it. However, when we start this conversations and talk about the other things, and when patients understand how we can use and how well used fillers can look very natural and just replace the volume that's been lost, and just completely with respect to our own individual anatomy, that's when I think we're getting a little bit more confident in trying to venture there a little bit as well.
Yeah, exactly.
As long as it stays within our own anatomy. And that's what I always explain, discussing this with patients, because I'm not willing to do anything beyond that as well. And I think that's also reassuring for patients.
Oh, definitely. And I think, one can look at yourself and think you look wonderful and very fresh and natural. And I have always personally felt that I would always want to see an aesthetic doctor whose aesthetic I actually think is appropriate.
That's why consultation is important. You need to find your fit. You need to find a person who has a similar outlook to, not only medicine, but also aesthetics. It's an art form, in my opinion. So that all has to line to the stars need to align to have the best result.
And you also need to find somebody who also values the importance placed on the consultation and the education, exactly as you said, because I feel that a lot of facial injectables have had a really bad rep in the years, the decades that have gone by that we've been using them, because we only ever see examples of quite bad work in the public sphere. And actually to have a conversation with somebody who is evidently educated and intelligent and natural and doing things from an ethical standpoint, I think actually goes a long way to opening up those conversations and making us realise that these aren't things to be demonised. They can sometimes, in the right hands, help us.
These are medical treatments, and I think this is the most important message, is these are medical treatments, and there must be an indication for every medical treatment. So I always discuss the indication, the contraindication, potential risks, etc. And it has to all make sense from a medical point to deliver those treatments. And what you can see, all the work that doesn't look great and patients are not happy with it, sometimes come from non-medical treatments, basically, because this is not a regulated situation in UK at the moment. Those things can happen. So I think doing your research, finding the right practitioner, finding a medically experienced medical practitioner is very important.
No, you're so right. And where do the substances like a dermal filler fit in? How do they support what you're doing with the exosomes, with the skin health, with the skin boosters, the collagen production? Where do they sort of...
I normally start with those treatments. I want to prep, put the skin, as you said, beautifully, just get the skin in the optimum position, in the best possible place, and then tackle all the issues with the skin. Do a little bit of skin booster, maybe some energy-based devices, tighten it, and then very strategically put a tiny amount of filler if it's needed, because our scaffolding is changing. Our bone density is changing.
Yeah, the skull is actually shrinking over time, isn't it?
And orbits are becoming wider. We're losing the position of the jawline. So those things happen at the background very slowly, but at some point they start to change how we look.
Yeah.
Also we lose volume, we lose our fat pads. So just maintaining our own anatomy, again, but it has to be done very gently. It has to be done respecting the longevity of those products, because they do last. And we want to look natural not only now but also in 10-15 years time, and I think the long-term results are very important. That's what I always think about, how do I make this patient look good not only now but also in 10 years.
Absolutely.
That's important.
And also if you're starting these treatments even from a younger age, I mean there are girls, women starting these treatments at a very young age now. You need to have some respect for your facial anatomy, for your skin, for your facial structure, and think, what are these doing sort of long term? Like, if we're going to be using these for 10, 20, 30, 40 years, it's so much better to take a small and precise approach.
Absolutely. And sometimes we don't have to get there. Sometimes we can postpone certain things. Sometimes doing things like exosomes or energy-based devices can postpone things, before the time before we actually need to go there with a little bit of filler. So it depends very, individuals, very case by case, but I think it has to be done very responsibly. And we need to make sure that those treatments are going to benefit patients in the long term as well. And
there's also this trend towards sort of what everyone is calling a holistic approach, a global approach when it comes to injecting, right? And I think that's also key to the longevity and the sort of understated elegance of the facial injectables, not just going for the cheeks or going for the lips or whatever it might be. I mean, you sort of a very... I suppose, you sort of scatter it around the face, don't you?
Yes, and sometimes I think it's the case of we sometimes lose a little bit of, we're not never objective, but we can lose a little bit of objectivity if it comes to our own faces, and we become very hyper-focused about one little line or one little fold on one little shadow. And sometimes, it's good to have someone to discuss this with, so we don't end up having a scenario of the line looks better, but the patient looks worse.
Yes.
So that's always, a good...
It's the same analogy as losing weight, isn't it? You know, we all focus on one part of our body and we're like, you know, it's still the hips. And actually in the meantime, you're losing weight everywhere else. Your face is becoming thinner, and you've got to keep it in perspective as well, and have somebody who can point you in that direction. I have to ask you very quickly about the narrative surrounding dissolving filler now, because I don't know if, you know, people have been, you know, following the sort of press, and there are stories about, you know, filler lasts so much longer than we ever thought, and now we're all dissolving it to get back to this sort of natural appearance, and which is rubbish. But I mean, tell me.
So I think there are two subjects here. One is the trend of overfilling. Is hopefully looks like it's not going anywhere. It's like, I think it's not trendy anymore. So there are some people trying to dissolve the overfilled face.
Yeah.
Which, you know, it's difficult to comment, because again, dissolving a filler is a medical procedure. The agent that we use to dissolve, it's called hyaluronidase. It's a prescription-only medication. It comes with a set of risks. There have to be indication to, to
use it.
Because it can come with, you know, all sorts of risks, including anaphylactic shock. So there are certain risks. It has to be thought through. So I wouldn't willy-nilly just start dissolving something, you know, because, you know, patients
because it's become a
more
trend,
and then less and then more and then less. We have to really have the proper treatment plan in place in the beginning to make proper decision, to decide when we need the filler, how much of it we will need. So we don't have to find ourselves in those situations.
Yeah,
and
that's
I
so
think
true.
taking the time to plan and having a proper consultation to actually discuss all of the potential risk will minimize the risk of dissolving it.
Yeah.
I would be very careful about that.
I think ultimately it's not a trend. Like,
It's not a
sadly,
trend.
a lot of, you know, press might make out from time to time.
It's not a trend. It's a medical procedure that comes with risk of, you know, as I said, you know, allergic reaction, anaphylactic shock, but also prolonged redness, etc. So it's not something I would advise to everyone. Best not to overfill. Best to do it, responsibly from the start, from the get-go, and then we don't have to think about.
What are your final thoughts on how we go about sort of destigmatizing the conversation on sort of women's health, particularly sort of with regards to the area that you specialize in?
I think it's changing. I think there is definitely a change that my patients talk more openly, especially about skin boosters, about energy-based devices. Fillers are still a little bit, you know.
I feel like skin boosters are almost like that gateway.
They're opening the conversation a little bit, and then somebody can whisper, you know, that there is a little bit more to that. But it starts the conversation definitely, and I think it's changing a little bit, that it's okay to take care about ourselves.
Yeah, exactly. Exactly as Tania said as well, you know, if we're living into our 80s and 90s, like, it's surely all the work that we're doing at this age is only going to sort of make it a smoother sail.
Yes, and I think because the narrative is more about skin health and prevention, it changes the way we think about all the aesthetic procedures.
Yeah, that's so true. In the same as many areas of medicine, you know, as soon as it becomes preventative, it takes on a more health connotation.
Absolutely.
That was really, really fascinating. And thank you so much, Aggie. And if anyone has any questions for Dr. Aggie, she'll be around at the end, and you have your referral card if you want a more one-to-one introduction. Next is the amazing Dr. Selena Langdon. Selena has always been my first port of call when it comes to body shaping, body strengthening, body slimming, whatever you want to do to a body. She is your lady. And she also has a new little baby as well. So I feel like you definitely know everything about getting women's bodies back into shape when they need it most. Selena, you mentioned in your introduction that sort of the body is definitely sort of a real sort of interest for a lot of people now, and it's so true. It's really become a focus, whereas the face was always it for sort of a long time. You know, we're really thinking about the body now. Why do you think this is? Why do you see this having come about?
We actually look at the statistics. They say that people's interest in body procedures, body contouring, anything to like target body areas, is actually much higher than it is the face now, because you will always find that a lot of people will have been thinking about it for a number of years, because our bodies change just as much as our faces do over time. Pregnancy, menopause, everything, it will have an impact on how you were in your 20s compared to when you were in your 50s. And I think that the focus where we were only kind of concentrating on the face, I think because the market started to cater for allowing us to have treatments to look at the body as well, it just opened up everybody's sort of mind to what's actually available out there. And I think we as a practice sort of thought actually it would be interesting to take a focus on this, because there are a lot of practitioners out there that offer solely facial aesthetics. I mean, we offer facial aesthetics too, but it's all encompassing, it's everything, it's top to toe. And actually we're a nation where we're not like America, we're not like Australia, where we like to necessarily walk around topless and that kind of thing, because we don't have the weather for it, although it is pretty nice at the moment.
Otherwise we'd all be out there.
But people like to look good in their clothes, and I think when they feel that things aren't quite in proportion, or something's changed after they've had a baby or whatever it might be, they want to be able to find a treatment that's going to be able to assist them with that. And I think, although, as I said, I'm an advocate for surgery, I think surgery frightens a lot of people still, the risks around it. And, you know, it's become a lot safer, and there are some fantastic plastic surgeons out there. But I think a lot of women especially, because we do see a lot more women coming for treatments like this, although, as I said before, we do see a lot of male patients as well. They like the idea of having a treatment that isn't going to have the downtime that's
of surgery, and the preparation,
and they want to go somewhere reputable and safe, and they want to see results as well. So I think the technologies have advanced so much now. You know, sort of 10-15 years ago, maybe they weren't as good as they are now. But even device energy-based companies, they are really trying to focus on improving the quality of their technologies. And we see some really good results, and they're very popular. And I think it all sort of goes hand in hand. I think when you're seeing facial aging, you are getting just as much aging in your body. So why wouldn't you want to look after it as well?
But I was speaking to a body surgeon recently, and he was saying actually all of the body surgeries and conversely the non-surgical body treatments, it's about restoration as well. And it's really putting your body back into the place. You know, fine, you might have your sort of breasts done after your baby and go, well, actually, I'd rather they were a cup size bigger or a little higher or whatever. But ultimately, I think with our bodies, we often just want to go back to a place where we feel like ourselves again, you know, whether we're struggling with a bit of weight, a bit of cellulite, some lax skin, it's almost that sort of just, you know, and I said this because actually this is in complete contrast to the sort of wanting to look facially 10 or 15 years younger, but it is almost that sense of, oh, I looked at my best, you know, physically, my physique was at its sort of optimal when I was this age, or before my second baby, or before I hit menopause. I mean, are those the sort of key chapters that you see women sort of coming to you to have support throughout?
Definitely. I think it's the loss of identity, isn't it?
Yeah,
I think
definitely.
Having a baby is the most fantastic thing ever, but your body changes significantly. I mean, there are some women that spring back from pregnancy amazingly, but a lot of women don't necessarily do that. And the changes that your body goes through menopause, it's quite significant actually, the amount of skin laxity that you find in areas that would never have had skin laxity before. And I think it's just that women want to feel empowered, they want to feel confident in themselves. And I think it's not that they're saying to me necessarily they want to look like they're 20 again, but they certainly want to feel confident in their clothes and just, you know, and they also want to be able to look good on a beach and that kind of thing, because actually, you know, you should still be able to feel confident when you are exposed, and, you know, even if you're in your 50s, 60s, well, why not? I think, as you've just said, we're living a lot longer now, and I think the sort of, I've seen a lot of photographs recently where they keep showing comparisons of what women looked like when they were 52, sort of 30 years ago, compared to what a 52-year-old woman looks like now. And there's quite a difference. I mean, you look at the likes of Jennifer Lopez and, you know, Jennifer Aniston, they look amazing, and, you know, they're in their 50s, so why shouldn't we be allowed to look good for our age? So,
and I think also it's down to how we feel energetically as well. And I think if people are, you know, we're living longer, we have all of the sort of support at our fingertips to internally feel better, you know, the supplementation, the sort of therapies, the drips, the mental health support, the menopausal support. So I think if we are feeling more energetic, more vibrant, more like our best selves as, you know, sort of life goes on, it sort of stands to reason that we would want to retain that physical sort of appearance of us at our best as well.
I mean, I see a lot of patients going through different, you know, changes in their life. I have a lot of women that will come to me having separated from a partner that they've been with for 30 years, and then all of a sudden they just sort of think, well, actually, what am I going to do now if I want to meet a new partner? I've only been with one person for the last 30 years, and I feel like I'm going to have to look different, feel different for a new person that might come into my life now. And I think it's, I don't see why that conversation shouldn't be something that we're all talking about, because actually maybe it wasn't discussed as much sort of 20 years ago, but now it's a lot more open. You have so many documentaries about women's health and Davina McCall's all over the television all the time, constantly talking about things that actually women want to feel good about themselves. They want to feel, as I said, empowered. So I think I'm really glad that I'm in the sector as we're kind of growing as it is now, because actually the focus on women's health has become huge.
Oh, it's incredible how much it's shifted in the past years, and I think it's really the backbone of having conversations like this, seeing sort of where the public sort of sentiment is taking us. What are the specific things that you would say are bringing women to your door or on the day-to-day? What are the physical concerns that we're sort of noticing at any of these stages of life, or even right at the beginning of our sort of aesthetic journeys?
It's a lot to do with skin laxity, I think, when it comes to the body in particular. Sometimes volume loss and the shape has changed as well. I do see a lot of women that come, I think I've mentioned to you in the past, I treat a lot of mons pubis fat, and that's something that a lot of women actually have.
And that's the area sort of just below your sort of nipple line?
Yes, yeah, and I think it's something that a lot of women feel they have a lack of confidence over, especially if you're wearing like leggings or you're doing yoga or something like that, or in a bikini.
Yeah.
There's just parts of the body that are concerning. You get skin laxity in the breast area, everywhere can change, including the buttocks, for example. They start to get a lot flatter, they lose their sort of elasticity, they don't sit in the same position as they used to. So there's just various different things that they tend to present with.
And we notice this so much more because also the clothes we're wearing are changing. Your conversation about, how we were aging 30 years ago, the way that we were dressing 30 years ago is probably very different. You can't go to the supermarket without saying, most people there in their sort of exercise gear and their leggings and whatever it is. So we're wearing these very sort of form-fitting clothes all of a sudden as well.
And I think that's a lot of what's presented when they come to speak to me about it is that they just feel that things have changed and they want to now start doing something about it, but they don't want to necessarily take an aggressive approach. I think you have to treat the body quite differently to the face, because it's a different way of treating an area and targeting it, because I think the face is a very less is more approach, but sometimes with the body you have to be that little bit more, although not as aggressive as surgery, but more is more in some senses, definitely. Because the skin is different. It has a different way of handling technologies. There are different devices for the face as there would be for the body. And I think as well as we're sort of going through these changes in life from even 30s through to sort of 60s, the way you hold on to subcutaneous fat as well changes over time, and it's harder to shift it. And certain different areas of fat behave differently in different body parts.
And that's all sort of hormonally driven, I guess.
Exactly. And it's hard to sort of target it sometimes, because you have a lot of women that will come to you, they've said, I've been on every diet I can think of, I have tried every cream there is out there, I have, I'm not quite ready for liposuction yet, but I have these stubborn pockets that I want to try and target. And you sort of see it time and time again. I mean, even sort of fat in areas here around sort of the bra area, for example, it wouldn't have been there pre-pregnancy possibly, and then all of a sudden it can start to appear. So
it's interesting where the body chooses to hold on to fat sometimes.
It's always in the places you don't want to, basically.
Agreed. But we are very good at dressing in a way that can hide it sometimes. So what are the technologies that you sort of find you're saying incredibly good results with for these sort of concerns that maybe women are presenting with more now?
Our number one technology that's always been our number one has been cool sculpting for a long, long time, and I think it's had its ups and downs in the press of late, but I've worked with the technology for many, many years.
Yeah, you were on board right at the beginning.
Yeah, and it's been very reliable. The right patient, the right candidate, the right treatment area, you can get some fantastic results with it.
And in the right hands as well, because it's actually quite rare to find a doctor such as yourself who administers this treatment. Quite often it is somewhat delegated to maybe a therapist or someone more sort of junior in the team. But again, I think with that sort of doctor's hat on, you can really make sure that what you're prescribing treatment-wise is the right thing and a safe thing, hopefully, for the patient.
Definitely. I think, as Aggie's already mentioned, we are an incredibly unregulated market, and I think you can have clinics offering treatments and services and they're not thinking about the safety of whether that technology is even safe to be delivered in the first place. I oversee a complications panel for that particular technology, and the amount of complications that come from places where they've not taken care to deliver the treatment safely. It can cause burns, it can cause significant indentations, it can cause irregularities, and I think the assessment is so key. If you don't select the right patient for the treatment, you're not going to get good outcomes.
And obviously it's not a weight loss device as such, it's more about, like you said, those little pockets that people with all the dieting in the world haven't been able to tackle.
Exactly. I have a very strict triage system. I assess whether or not I think somebody's suitable for treatment. When they come in, we might even ask for photographs before they attend for their appointment, because it would be wonderful if I could wave a magic wand and my machine could remove fat from every single person in the world, but that's not always necessarily the case. The surgery certainly has a place in that instance. And I'm very honest. I'm one of those sort of people. I like to be honest about what we're capable of achieving and what results we can deliver. I don't want to sort of give people sort of false hope. And I like to set expectations. But we can certainly help. I always say, I think it's the word improvement is what we can do. I might not be able to make it exactly perfect as an abdominoplasty, for example, but I can certainly give you really good results that you might feel really confident with without having to go under a knife, which for a lot of women actually they don't have the time. They've got families, they're busy, they've got jobs and all that kind of thing. They like the idea of being able to have a treatment. It takes an afternoon and then they can carry on with their life straight afterwards. So I think that's always been our mainstay, but then we've introduced other technologies.
What about for the skin laxity? Because you said that was a massive one at sort of every chapter.
We have a lot of it's mostly radiofrequency. We have several different devices that we've used for a number of years. I think the skill with radiofrequency comes down to the practitioner. It's if you are very good at delivering it, you can get some really good outcomes. But I think it's adhering to protocols, making sure, again, you treat the right patients. Stretch marks, for example, can be quite tricky as well. There are lots of different treatments that are available for them because, again, women might develop a significant number of stretch marks after pregnancy, for example. We obviously can't remove excess skin, but we can certainly improve the skin quality, tissue quality around
and the sort of plumpness of it as well. I definitely noticed after pregnancy the sort of the quality of skin it changes. Like the crepiness is so much more evident than it probably ever was before.
And it's hard to get back. You can do all the exercise you want to and try all the topical creams that you like, but actually, skin laxity when it's at that level, it's quite hard to treat, without introducing a technology like radiofrequency. And it works. It's sort of, there is maintenance that's involved, after a year or so, but as long as you're sort of prepared for that and you're going to have treatment. For example, we use Excelis. It works really well on the certain body areas, inner thighs, around the tops of the knees. They tend to get a lot of skin laxity. We even get patients presenting with laxity around their elbows, around this part of their arms. So I think it just depends. As long as you've got an appropriate technology for that particular patient and you set the right expectations, you can deliver some really nice results.
Yeah, no, I totally agree. You mentioned as well earlier when people have started to lose volume, sort of in the bottom, for example, that there are treatments you can do to support that. So how are you sort of replenishing lost volume, I suppose, and enhancing the body shape?
So this is where injectables sort of are brought in because, unfortunately, to try and increase volume, you can only use something to replace that volume.
Of course.
I in particular use Langdon, which is an injectable. It's not a hyaluronic acid. It's made of polylactic acid. I don't know if anybody remembers a product called Sculptra, but that used to be very popular for the buttock area. We've moved on from Sculptra because Sculptra used to have quite a lot of issues from sort of lumps and bumps, and there's a huge amount of massage involved. Langdon is very similar. We do facial aesthetics as well to a product called Elance that we tend to use for the face. It has a
collagen stimulator.
Exactly.
Yeah.
So it's quite different to the sort of procedures where you're having huge buttock augmentation because you can only really do that with fat and surgery.
It's not the sort of BBL,
it's not quite a BBL
your bottom
procedure, but if you've had some flattening and you want to just enhance it, then you can use Langdon to basically you're placing it in. It has a lot of volume initially because there's so much water injected with the product. But that sometimes dissipates a little bit at the start, but then after sort of 6 to 8 weeks you start to get a lot of collagen stimulation and it improves the skin quality as well. So it's not just the shape, the actual skin looks better. It can be used to treat cellulite as well, which is a number one concern for a lot of women.
How does it treat the cellulite in that it sort of smooths over the area where there's dimpling and makes it more uniform?
You water it down, you thin it out a lot more because you can't use it in the sort of quantities and the thickness that you would use to inject the buttock. But you basically can kind of scatter it through the sort of thigh area and it actually just improves the skin.
So it's like a polyfiller, just smoothing over
it's
all
really lovely results actually, and it has good longevity as well. You're sort of looking sort of 2 to 3 years. Changes,
really?
Which is
Wow.
quite nice for a product like that actually.
And how long sort of until you see the sort of best effects of it? You said there's a bit of initial volume at the beginning and then
you have
how
to
long
do a few sessions. Normally it's 2 to 3 sessions, and then normally after each session as you go along you see the changes in the skin and the tissue quality improving. It's quite large volumes that are injected for the buttocks, for example. It's about 80 mils in each sitting, so it sounds like a lot when you think about the quantities used for the face.
And
but
does it have like a numbing agent in it? Is it sort of uncomfortable?
Yes. You inject some lidocaine. Actually, very comfortable procedure. Once you put the lidocaine in, it's not that uncomfortable at all. And then we might complement that with using mSculpt, which is our other technology that we use for muscle toning.
Oh yeah, that's the sort of muscle stimulation, like the sort of the paddles that go on the bottom.
Exactly.
And what do they say? It's the equivalent of like 30,000 squats or something incredible.
Like half an hour or something. So we have the mSculpt Neo, and it's using kind of different technologies. One that we'll probably be able to touch on soon with the Seller chair. But it's combined with radio frequency as well, so they put both technologies into the same machine, and again that helps to enhance the buttocks and to lift them basically.
That's so interesting. Do you think the bottom has become more of a sort of area of focus for us, because the focus on the breasts is sort of waning, and that people are not sort of wanting to go sort of so large in terms of size now, and it's all becoming a little more petite, but with the bottom, is it sort of the new area that we're sort of focused on a little more?
I think it's had its popularity for the wrong reasons in recent years, because of certain sort of celebrities probably giving it an unusual focus, I think. But most women, when they come to you, they don't want a Kim Kardashian bottom. They want something that looks
definitely not the ones who come
very
to you.
Sort of, exactly. They don't want that. They want it to look just enhanced enough that they feel good when they're wearing trousers. They call it a pancake bottom. They just don't want a pancake bottom.
Yeah.
And they want it to just look, enhanced and improved enough that it gives them a nice shape and contour. I've never had anybody come to me and ask for something overly enhanced.
Yeah.
And hip dips are really popular. Actually.
What's the hip dip?
It's the dip that appears at the side, just at when you kind of see where the contour of the outer thigh appears. You can then get like a little bit of a dip from the waist that appears at the side that looks like it gives you a slightly unusual shape, and if you fill in the hip dip, it just gives a nicer shape and contour.
So you keep that sort of more hourglass,
and it looks really, very subtle. You wouldn't necessarily know that somebody's had that treatment done. Very natural, and that's quite a popular one to have treated actually.
And I suppose sometimes it's less about the sort of the bigger picture and sort of the little tiny details. It's a real trick of the eye sometimes when you do shape the body, because you might argue that you're adding volume by doing that, but what you are doing, similar to when you sort of do somebody's nose, for example, you're still smoothing out that contour. And I think that's really empowering, because people don't necessarily want to lose weight or be any smaller or any thinner or whatever it is. They sort of want to keep their shape but just perfect those tiny little bits.
Exactly, and it's these sort of treatments will continue to be popular, I think. I don't think we're ever going to shy away from wanting to have treatments where we can do treatments, but they're subtle enough that they give enough of a change but not so extreme that they look obviously as though you've had some work done. And I was going to also mention that with skin laxity there are other injectables that you can use. We've talked about exosomes, so I've started using polynucleotides quite a lot
and these are a huge sort of trend right now.
They are really good for sort of skin laxity, and certainly especially the sort of decolletage. It's really nice for treating on the chest
and in sort of sun-damaged skin as well.
Sun-damaged area and sort of around this part of the arms. They again behave very differently to hyaluronic acid, because I think a lot of places are moving away from hyaluronic acid for its use as a skin booster, I suppose, because although Profiler have a body product, for example, which does work very nicely. It is a really nice product for certain body areas which have skin laxity. I've recently found that polynucleotides seem to give a nicer result and actually come with far less downtime, risks, complications and problems, because they don't swell as much, they don't look as lumpy or bumpy, they seem to give a really nice sort of smoothing effect to the skin.
Some of the skin boosters, you do have to be mindful that they don't attract too much water as well. If you're somebody who's prone to a bit of water retention, then maybe you're not always the right candidate for some of them.
It's opened the door to giving me an option for patients that I would have originally turned away because of not being able to use hyaluronic acid in them. So I kind of feel that maybe polynucleotides might keep getting more and more popular, because they kind of tick a lot of boxes without too many issues.
Yeah. And sort of, what are your final thoughts on I suppose what these treatments are actually doing for the women that come to see? I mean, obviously there's the aesthetic result that we get from them, and you've explained that all really beautifully, but do you think they impart anything sort of further in terms of I suppose an emotional sort of confidence?
Definitely. I think confidence is one thing that a lot of women, when they initially come to you, they're very nervous about talking to you about treatments like this. They're not confident taking their clothes off to even show you the area that they want to have treated. For example, the mons pubis area has always been a really tricky one for women to talk to me about, and then you can genuinely see on their faces how upset and concerned they are about having that area treated. They might not even show their partner that area, for example. And I think giving them that confidence to be able to sort of walk out and feel as though, I had a lady who just wanted to be able to take her grandson to yoga with her, or to whatever play park he wanted to go to, and she wanted to feel confident wearing leggings, and that was a huge deal for her because she'd never been able to do that before, and it massively made a difference to her. So I think women just want to be able to feel confident, empowered, just be able to be themselves and not have to feel as though they've got to cover up and hide, and just feel as though they can be, feel good about their bodies, which I think we're all entitled to,
100%.
especially if we're all living as long as we're going to be.
Yeah, I couldn't agree more. Thank you, that was super interesting, and I'm sure there'll be plenty of questions and whatnot, but if not, Selena will be here. Do tick the box next to her name and we'll connect you afterwards. And thanks, Selena. And our final speaker, let me get my notes, is Tania. She's introduced herself, gynaecological oncologist. Did I say that correctly? Other way around?
In a previous life.
Yes, in a previous life.
Yes.
Now sort of gynaecologist, BHRT practitioner, and an absolute font of knowledge on all things menopause, women's wellness, and whatnot. But Tania, tell us, have you noticed a difference? I mean, we're obviously talking about women's health, female intimate health so much more so, but have you noticed a spike almost in women actually then coming to your door as a result, or is there still some way to go?
So I think we're recognising now that vaginal health is so important. A good functioning vagina has such an effect on how we feel about ourselves, our femininity, our self-confidence. And if there are vaginal issues, then that can really have a really negative impact. And I think with the help of women's programs, such as the one that Davina has been presenting, that we are talking about women's issues more, and we're more comfortable saying the word vagina and recognising that vaginal health is so important to how we feel. So I am seeing a lot more women coming forward and saying, look, I know now about vaginal dryness, I'm still embarrassed to talk about it, but more of my friends are now talking about it. They've all got the same issue that I have, and issues with the bladder as well. So I am seeing a lot more women coming forward at all ages. These are not just menopausal women, these are women having had 3 children in their 30s, having issues with incontinence, with prolapse, with urgency. So the vagina is affected by all things that happen in our life: pregnancy, age, hormones, vaginal issues. So in each decade we see different issues.
And it's really incredible that the conversation has sort of come to where it's come to in terms of women's health right now as well. And I think it sort of really makes you realise that there's an argument for not having to put up with a lot of the conditions that probably women, like you say, a woman in her 30s who's had 3 kids, like I think historically perhaps women have always been told that this is the situation, this is what you've chosen to do, you've had 3 kids, whatever it might be, this is sort of life and you have to live with it. And I feel like it's really empowering now that these conversations are taking us to a place where we're realising that there are things that can be done.
So historically, women did have to put up with it. Well, it's just part of getting older. Well, what can you expect? You've had 3 children. Oh, what can you expect? You're in the menopause now, you just have to get on with it. But we now have technologies which can improve vaginal health in terms of dryness, laxity, incontinence, prolapse, so that women can feel normal again and lead fulfilling, good quality lives, for decades.
Yeah, absolutely.
As long as they are proactive and look at having treatments early on, which can be very easily addressed.
Yeah. Does prevention help when it comes to vaginal health in the same way that it might do skin health or sort of the aesthetic treatments we've discussed?
I think being proactive, yes, is very important. If there isn't an issue, you probably don't need to have a treatment because anything you do isn't probably going to improve the quality of the vagina. But, for example, women in their 40s, the collagen's reducing, there is increasing laxity, pelvic floor tone may be reducing, so the strength of the pelvic floor will impact on symptoms and vagina and the bladder. So yes, being proactive at that point, when you feel symptoms are starting to creep in, that's the time to start looking at doing something about it.
It's interesting because you said you see sort of women at all sort of ages and stages. So what are the sort of the key things, I suppose, that bring them to your door in terms of the complaints?
So for the young women, these are women who've had 2 or 3 children. They're fitter, they're active, they wear their leggings, they want to go to the gym, and they leak. And they have to wear dark leggings because otherwise it'll show. And it's it can be really embarrassing.
Yeah.
Sex doesn't feel the same anymore. They don't get as well aroused, or sex doesn't feel as satisfying, both for the woman and for the partner.
And that can really drive a wedge sort of between relationships at that stage of life as well.
Oh, massively, massively. So these are women who come to see me for radiofrequency because it brings together the collagen and the elastin, it improves blood flow, it strengthens the vaginal walls, so it can really help with incontinence and laxity and really improve vaginal health at that young age. And women who are a little bit older than that have the effects of aging, of decreasing hormones. And we know that hormones can decrease 8 to 10 years before the actual menopause. So just as...
in that sort of perimenopausal sort of chapter.
Perimenopause can start in late 30s, early 40s. So both hormonally you want to stay well balanced and also start thinking about vaginal health at that point. Dryness, we know, can set in women in their early 40s. And again, you want to be proactive and start treating that before it gets so dry that then it becomes much harder to treat. Yeah,
exactly. And with things like the radiofrequency, how does that work? That's like a sort of an internal probe, is it, that sort of then emits the energy?
It is. It's an internal probe that has an active tip, which is delivered along the vaginal walls. It delivers heat, which then regenerates the collagen. If you think how the vagina is stretched 10 centimetres during vaginal birth, all those elastin fibres get torn.
Yeah.
And what radiofrequency does is it helps to bring those elastin fibres together through the heat that's delivered.
Will they naturally come back together otherwise, or if they do, it will be in a slightly sort of different configuration?
So in America, women are being encouraged to have a radiofrequency treatment 6 weeks after a vaginal birth.
Really? Wow.
To encourage the vagina to heal more optimally than if you leave radiofrequency too much later. So vagina doesn't necessarily heal. The elastin fibres can stay broken and the fibres don't necessarily come together.
Yeah.
So radiofrequency can really help bring those together. It's an 8-minute treatment. It's 3 treatments at 1 to 2 weekly intervals initially, and then just as with all treatments, face, body or vagina, you have to come back for maintenance treatments, and that's roughly 1 treatment once a year.
Okay, like your annual top up.
Yeah.
And is there an argument that sort of you need to do these treatments sort of in the sort of months or the year following something like a pregnancy or a birth, or can you still get the benefit sort of years down the line?
You can get benefit years down the line, absolutely, and it all depends on symptoms. Some women don't feel any symptoms until much later.
Yeah.
So maybe 10, 15 years later, and you still get really fabulous results then. If there's also a degree of pelvic floor weakness, again after a vaginal birth, the whole sheet of the pelvic floor muscle can weaken, and we often combine the radiofrequency treatments with the Emsella chair, which women sit on, a little bit like the body treatments. It shines energy at the pelvic floor, and it does 12,000 pelvic floor contractions in half an hour. And the point is that the contractions that it induces are stronger than you could ever do with pelvic
Or could ever
physiotherapy.
remember to do. I mean,
Well, exactly.
I don't think I did any
None of us
pelvic
do.
floor exercises.
So-
My frequency.
Yeah, exactly. So it's a really nice adjuvant to doing your own pelvic floor
But
exercise.
it's nice as well because you can. I mean, this is literally the first treatment I booked in for after I had my baby. Before I did anything to my face, sat on that Enzella chair, and it's fantastic because you don't have to take off your clothes. You can read a magazine. I think you can even do your emails on your phone, can't you? I mean, it's a very good use of 25 minutes perhaps, and you really do feel like you're getting. I don't know that you're putting something back into your body or strengthening an area that you could perhaps otherwise have overlooked, but has actually been through a huge amount.
Absolutely, and pelvic floor health is really important, keeping the muscles strong. It's supporting the womb, it's supporting the bladder, it's supporting the bowel, and it's really important to keep that strong,
For the duration.
Yeah.
And it's not just vaginal births that will have that impact, right? It's sort of the weight of carrying a baby, it's sort of the signs of aging, it's menopause, like the bladder sort of weakness and the sort of leaks can come in for various reasons, right?
Yes, you don't ever have to have or have been pregnant to have a weak pelvic floor later on in life. So these women also benefit, as do men.
Yeah. And do you find yourself sort of combining a lot of these treatments then? You mentioned the radio frequency, the Emsteller. I know you also said earlier that you sort of did a lot with laser.
So women come to me for an assessment. I see what's going on, they tell me all their symptoms, and then I examine them, and then I will put a program together that is bespoke for them.
Yeah.
And not all women need the same, so I may do a combination of radio frequency and laser. If there's a degree of dryness, laser tends to be better for vaginal dryness than radio frequency. It can also help with bladder function. So I combine treatments, and I also do treatments with platelet-rich plasma.
Oh yes,
where-
the PRP.
Yes, so where we take the patient's blood, we spin it down, we take the platelets, and I inject it just underneath the urethra. And what it does is it reinforces the urethra, and
So it stops it from becoming so sensitive almost.
well, it allows the urethra to close when you want to stop going to the toilet.
I see.
To prevent leaks.
Wow.
So in the NHS we use an artificial bulking agent called Bulkamide, which has to be put in through the cystoscope. It's done in an operating theatre. This is a more natural way of producing a bulking effect around the urethra.
So it will stay in the position, in the exact spot that you inject it, will it? The PRP?
Yes, so I inject it just underneath the urethra, and then it spreads out along the anterior vaginal wall.
Wow.
And it supports the urethra.
And this is something not done under any local anaesthetic, I guess.
No anaesthetic at all.
No anaesthetic?
No,
Do you inject that into your urethra?
The vagina has no pain fibres, so I inject it into the vagina, not into the urethra, just underneath, so it's just into the vagina. So this is
The
why
vagina has no pain fibres.
So this is why we could do radio frequency at quite high temperatures, and we do the laser. The vagina doesn't feel the pain.
How interesting. So hang on, the pain from childbirth is not from the vagina, it's from...
It's from the uterus, from the contractions.
of course.
So that's why it allows the vagina to distend without causing pain,
Yes.
to allow the baby to come through.
My goodness, how fascinating. How do you sort of make women feel comfortable about having these conversations? Because these are intimate concerns, and Selena touched on it earlier with saying the women who come in to have the mons pubis addressed can sometimes find that a difficult conversation to have, but arguably what you're doing goes that little bit deeper as well.
So, I ask them to be really honest, and we talk about the vagina and the bladder and sex and arousal, and I invite them to talk about that in a really safe space. It's all completely confidential, and I think sometimes they're quite relieved to be able to talk about these issues because they don't feel they have anyone to discuss them with.
Yeah.
Women can be quite nervous and shy about admitting to dryness, problems during sex, laxity, incontinence. They are embarrassing.
Well, yeah,
Issues
exactly.
to
Who would be
talk
your
about.
sounding board normally?
Well, exactly. So, they come to me and, I do feel that most women are really comfortable talking about them. Some women come to see me, say, I need help with the menopause. And then we talk about hormones. And then they say, well, actually, I've got another issue. I'm really embarrassed. Forgive me for sharing, and then it opens that up, and then we explore that. So, sometimes they're too shy to come specifically about their vaginal health. They'll dress it up as well. I have some menopausal issues, but actually,
yes,
it's
a good sort of like covers all bases, menopausal issues.
Yeah.
But I guess it does also feed very neatly into the work that you're doing with hormones and sort of BHRT as well.
So, life is all about balance, and the body functions better if it is hormonally balanced, both physically and mentally. And, deprivation of hormones long term makes you feel rubbish. It increases your risk of heart disease, which is the #1 cause of death in women in the developed world, and we never talk about that.
Yeah, nobody really
we only ever talk
cites that
about
fact.
breast cancer.
Yeah.
But it's heart disease that kills most women, increases the risk of dementia, osteoporosis, which is a silent killer, increases the risk of colon cancer, diabetes, metabolic syndrome, high cholesterol, high blood pressure.
My goodness.
And hormones can really help with all of that. We no longer use the synthetic hormones that we used years ago, which we know increase risk of breast cancer and stroke and heart disease. We use bioidentical hormones. And all that means is that the structure of the hormone is identical to the one that the body was producing, or the ovaries were producing before the menopause. And there are licensed bioidentical hormones, which some people like to call body identical, to distinguish them from bioidentical hormones that are made in smaller pharmacies, because the big pharmaceutical companies only produce estrogen and progesterone.
Not testosterone.
Not testosterone, not DHEA.
And a lot of women benefit from those.
Most, I'd say.
Really?
Testosterone is a normal female hormone. It helps with focus and concentration, with heart health, with motivation, energy, drive.
Confidence.
It helps with muscle tone, which is so important. I have so many women who come to see me who exercise every day, have a personal trainer, they can't maintain their muscle tone. And one of my patients is a professional water skier, trains all the time. She lost all her muscle tone. I gave her testosterone. She's, she's toned again.
Wow.
She doesn't want to be big, but, she can now do her professional sport more effectively now that she's taking testosterone in addition to estrogen and progesterone.
It's just sort of finding that sort of perfect balance, and I suppose what everyone needs as a balance will be different because our bodies are different, and so that stands to reason that you'd want this more bespoke approach. How do you tell? Is there sort of a blood test that determines where the imbalances might be, or can you just chat to people and figure it out?
Yeah, so my usual practice is to ask about symptoms in great detail, and I also do blood tests as well to guide me.
Yeah.
Sometimes women will say, I feel fine, I think. And then you do the blood test and you see all the levels are really low. So some women, once you've been menopausal for a few years and, menopause creeps up on you really gradually and you get the changes often very gradually over a number of years, and a lot of women just adapt to the new normal. They have no energy, they're not sleeping, they can't remember names, but they say, well, it's just how I am now, and I think I'm fine. But actually they're not, because it's been so insidious and it's been changing over years that they're just functioning at a suboptimal level.
And it's at a stage of life where you should sort of arguably be feeling at your most powerful almost, probably professionally, personally, you've sort of achieved so much in life by that stage. It should be a time of great empowerment and not a period of life where you're feeling like, oh, I can't remember everyone's names.
Well, exactly. So a lot of women are at the peak of their professions, they're running a household, they're juggling a lot of balls. And the great advantage of being in the menopause is that you can feel fabulous every day, that you're no longer constrained by these monthly variations in hormones,
Yeah, that's so true.
heavy bleeding, pain,
Should be a weight off your shoulders.
terrible PMS. You know, as long as your hormones are optimised, you really can feel fabulous every single day.
What are the final things that you think should bring women to your door? Like, are there things that we should be keeping an eye out for? Any symptoms, any feelings, sort of internally, externally, that should be the red flag or the warning sign to be like, actually sort of book in to speak with somebody like yourself now?
So, first of all, to recognise that perimenopause can start in the early 40s, and not everyone has hot flushes. That's, you know, a lot of women don't actually.
It's the most propagated symptom that doesn't necessarily hang on.
Exactly. So one of the early symptoms are fatigue, insomnia, anxiety, irritability, loss of confidence. Even though women are still having a regular monthly cycle, they won't necessarily associate that with decreasing hormone levels. And then close to the menopause, again, it's things like brain fog, memory loss, focus and concentration, it's anxiety, you know, and it's dryness, dry eyes, dry mouth, you know, and it's you know, it's a lot of women also find insomnia,
definitely,
you know, loss of energy, so it's not just about hot flushes and night sweats.
Yeah.
There are lots of other symptoms that can affect you.
That's really valuable to know. What was the last one? Loss of libido. Yeah, absolutely. Really worth bearing all of those in mind, and then I suppose finding a way to your door if that is the case. I think that's probably, thank you Tania, that was brilliant, that was really riveting. That's probably enough from all of us now, but it was really fascinating. I hope you agree, just to see how sort of all of our speakers' approaches overlap, and it's really interesting how sort of each of you own your sort of own area of female health, of women's health, and really I think all of your approaches individually are really about empowering and strengthening. And yes, you're all having an aesthetic sort of benefit and outcome, which is obviously important on the day-to-day. What we see in the mirror is obviously enormously important for our sense of self-esteem and self-worth, but I feel like you're really all sort of diving to the root cause of these things and hopefully sort of collectively helping us live happier, healthier, longer lives, which is really the aim, isn't it? While also de-stigmatising the conversation, may I add. I hope everyone found that helpful. We do have time for some questions. If you do have one, just pop your hand up and sort of we'll come to you. If not, I'm sure our speakers will be here for a little while longer if you'd like to chat to them any further. Were there any questions?
Okay,
Yes. Go, Karen.
You know, the mons pubis, how do you treat that? I can't imagine there's a full sculpting.
It is, yes.
Really for that area?
Yeah, so
Is that the same as the chin one or something? You just put it down?
Tiny applicator.
It's slightly different, it's completely off licence,
Okay.
but I do it because I've been working with full sculpture for a long time, because I oversee their medical faculty, or I am the medical faculty for the device basically, there isn't anyone else doing it. I just created my own protocols with their sort of oversight, and they were happy for me to do it. So
not many practitioners would actually be treating
I
it
don't
with
think
cool
there are many at
sculpting.
all. I think because they don't, as a company, they discourage it unless you're very experienced, because obviously there's a lot of stuff that you have to be careful of, you know, treating in terms of anatomy. But yes, you can use an applicator very successfully, because if it is just subcutaneous fat, which is what the mons pubis fat generally is, it's just a mound of fat, you can treat it really nicely and it works really well, and actually you get improvement in the skin laxity there as well afterwards.
But if it's off-label, what's what's it made for originally?
No, so it's just that I'm using that one of the applicators that would usually be for a different body part, for example. It's just that the company, as with every technology, they will have guidance as to what you are permitted to do. So they're guidelines that you are allowed. But the mons pubis is one that they've never developed a protocol for practitioners to use widely. But because I was getting so many inquiries about it, I just thought, well, why shouldn't
Do you think that's something that's going to change? Maybe they will sort of put out the guidance because it is an area that people are becoming more interested in, or is it still too complicated to?
The vast majority of cool sculpting treatments are delivered by non-medical practitioners.
Yeah, fine.
They would never allow it to be widely, you know, sort of treatment that's
Yeah,
delivered,
of
because
course.
it's just the risks would be
Do you
too
want to
high.
use Aquilix or something like that there? Because it's quite a small area, isn't it? You're treating
Like a fat dissolving sort of
Actually,
injectable.
often the mons pubis patients that come to see me have very big mons pubises to treat, actually. And Aquilix just wouldn't touch the sides.
Is the mons pubis just fat that needs to be addressed, or is there sort of an underlying anatomy like muscle? Or
It's not usually, for the ones that I usually treat, I usually treat if they have subcutaneous fat. I wouldn't do it if I was concerned that there could be other things going on, if they've ever had a history of hernias or anything like that, that could complicate it. As long as it's a straightforward case, and then it's just about addressing the size of it. Obviously, if they have other areas of, that I'm worried about, that maybe they are very overweight and there's lots of other things that could be involved, then I try to encourage them to address all of those things first. But sometimes you will just get a patient that looks very slim, but for one reason or another, they just have a very large mons pubis, but they've had it their whole life.
it's like a genetic
Exactly.
thing. Yeah.
It won't necessarily be, I mean, I have male patients that come for treatment with it as well, so it's not just women that will present, it's just it happens to be an area that I think when you're physically enclosed, it's hard to disguise it. You can't really hide it in a swimming costume or a bikini or a pair of leggings.
I love that we've come to a place though where every tiny area of our body can now be optimised as well. Anything that is bothering us psychologically.
Can I ask on the mons pubis, Tania and Selena? I'm not sure what. Could you clarify that our mons pubis is sensitive to estrogen, so typically it can regress when we get to menopause. Am I right or wrong with that?
I've seen it get bigger.
Yeah, women don't really come to me for that, but I mean, usually you do get loss of volume, certainly in the labia majora, so either side. And I think the mons pubis, which is at the top, suffers less than the vulva itself.
So it's not sensitive to estrogen, because I think I read that and I would say that, but I might be wrong. So
I think it is sensitive to estrogen, but I've never seen the case. I mean, I have a lot of postmenopausal women that come for treatment and they have just a lot of fat there. It's not actually something that seems to reduce in volume. If you compare it to the labia in most of those patients, obviously they're completely undressed when I have to do that treatment. I would say they probably have some atrophy there, but their actual mons pubis still looks very enlarged.
On that note, Tania, because you do a lot of injectables to that area as well, where there is, like to the labia, where there's a loss of volume and sort of collagen. Is that something that you're doing more of?
So I'm seeing loss of volume actually. So I treat a lot of women who have loss of volume in the labia majora, which are more lateral to the labia minora, the small labia, because you start to lose volume in your mid-20s. So loss of volume and age can make that tissue there look quite wrinkled. So I often will treat the skin with radiofrequency to improve the quality of the skin, tighten it a little bit, and then I'll put injectables in to improve the volume. It's a heavy injectable, it's a heavy hyaluronic acid, the Desirol Plus, which is especially licensed for that area.
So
Works incredibly well, and that's not just an aesthetic concern. It's
functional
it's comfort. It's comfort. It's uncomfortable to sit.
Yeah, you hear about a lot of riders, horse riders.
Yes,
I think who benefit from it.
Yes.
Cyclists as well.
Absolutely. Yeah.
The cycling epidemic. I'm sure you'll be seeing more and more people.
Yeah.
There's a lady back here as well.
So I had a hysterectomy in October, never had children, and I've had blood tests done by my doctor just after my operation. They left my ovaries, confirming that I hadn't gone into sort of menopause. But I'm starting to see more and more side effects, even though they left my ovaries. They said 5 to 8 years they could survive. But I am noticing more and more probably menopausal symptoms.
So that's really common. So when you remove the uterus but leave the ovaries, you're reducing the blood flow to the ovaries. So they don't often have another few years, and their function does often start to decline way before that.
Okay.
So I'm not surprised you're experiencing symptoms. I think this is the time to start, rebalancing your hormones, and you probably only need a little bit of a top up.
Yeah.
So just a low dose of estrogen, maybe testosterone, But I wouldn't sort of leave it too late
Okay.
until you feel absolutely dreadful.
So the doctor, just go and see the doctor or
Yes.
interview or
Yes,
yeah.
yes, absolutely.
Thank you.
Lady far left.
Hello, yes, you mentioned bioidentical hormones. How would you advise if you had been on synthetic hormone for quite a long period of time, would you be able to cross over onto that?
Yes,
Would
so-
it provide the same kind of, I don't know.
Yes, so I have a lot of women who come to see me having been on synthetics for a long time who would like to switch over to bioidenticals. So we have to, estimate a combination that will probably work for you, and I would give that particular combination to you for 3 months, get you to come back to have blood tests, see how you're feeling, and we'd have to make adjustments. So we may not get it right first time, because estrogen we like to now give through the skin because it doesn't increase the risk of thrombosis. So I can't predict how much estrogen you're going to absorb through either the gel or the patch. I need the blood test to guide me on that. So sometimes it takes 2 or 3 check-ins until we get the optimal combination for you, but it's very doable.
It is.
Yeah.
Why do you see people coming to you who have been on synthetic and looking to swap? Is it just a personal choice, a lifestyle choice?
Usually because their friends have recommended they switch, because they're doing bioidentical hormones through me, and they've told their friends about it, and their friends say, well, I'm not on that, I want to be.
It's amazing how much the opinion of one's like friends or family, I think they say that's one of the major drivers in any sort of treatment, is if your friends are doing it and talking about it, which again I guess is why having these conversations and making it more conversational is so important.
And a lot of the women who come to see me come through a personal recommendation.
Yeah, I can imagine.
Yeah, so yeah.
Was there a question? This lady here.
Yes, I really in response to you, because I just recently switched about 3 or 4 months ago from synthetic to body identical or bioidentical, because I'd also read that perhaps this was not a good thing to have been on. I've been on the synthetic one for years and years and years, happily switched over, and that's good. So my next question is obviously, how long can we keep on with this? Because as far as I'm concerned, I would just like to take it until they sort of nail the lid on the coffin.
Forever,
Music to my ears.
You should do that. So the recommendation from all the menopause societies around the world, the British, the American, the Australian, the German, the international, they all now recommend hormones should be taken lifelong as long as the benefits outweigh the risks.
Yes.
So keep them clutched to you.
Yes, no, I've
very
got
tightly.
no intention of stopping.
Never
But it sounds
stop.
like there are so many health
Yes, I'm
benefits,
told.
all of those, the
Yeah.
decreasing the heart disease, the osteoporosis. Isn't Alzheimer's on the list as well?
Yes,
like,
yeah.
what? Yeah, I mean, definitely carry on.
Music to my ears.
My question is specifically around blood testing versus the Dutch hormone test, because I'm a firm believer in BHRT, where I'm with a professional who uses the Dutch. I just want to know, for accuracy, for my best prescription for me, why do you use blood, and if you could just address that, blood testing instead of
Okay,
Dutch.
so the Dutch test tells you all about how you're metabolizing estrogen, and I think that's really helpful. And yes, saliva testing does give you some information. We are taught by the BHRT experts that Dutch tests do have a place to look at metabolism, but in order to guide us on dosing, we're taught more to be guided by blood levels than by a Dutch test. And just in terms of practicality, blood tests are reported within 24-48 hours. Dutch tests can take 3 weeks. So, it's a real, involved process to keep doing a Dutch test every 3 months, and I have to wait ages to get the results. So there is a place for Dutch tests. A lot of my patients love it, and I do use it. But in terms of dosing for hormones, I use blood tests.
Yes, lady at the back.
Somebody who's had estrogen positive
breast cancer. How does that work when you do need to? Does that mean you can't take like HRT and things like that because of that?
So traditional teaching has been, if you have had an estrogen-sensitive tumour, you must never take estrogen in any form.
Yeah.
I think the guidance and the whole view around that is changing now. There's an eminent professor called Adam Blooming who's done a recent review of 15 studies in women who have taken HRT after an estrogen-sensitive tumour. And in 14 of those studies, the women didn't have a higher risk of recurrence. Only one study showed a higher risk, but we think that study was flawed because women were not tested on entry to the study, so they may have had a pre-existing recurrence, which only then became evident once they had gone into the trial. So we're a little bit more fluid on that now. We like you to have been free of recurrence for maybe 5 years, and then we try non-hormonal strategies first. We always do, that's good practice. But there are some women whose lives are so badly affected that they literally cannot get through the day, and their quality of life is so bad that they are willing to take the risk, and they take hormones, and many of them very safely, successfully, for many years. So it's not cut and dry at all.
Yeah.
Yeah.
Was that it for the questions? Did I miss anyone? No. Yes. One more.
I've got one on skin inflammation. What are the main causes and what can we do from a lifestyle perspective to slow that?
It varies. It can be hereditary, but there are also, in terms of the factors, that's sun damage, rosacea, eczema, psoriasis. So there are different types of factors and also hereditary issues. Starting from the milder range, proper skincare, we have to obviously analyze, see, we usually use too many products on our skin, so we're not helping the inflammation. Most of patients, when they come to me, and I ask them what they use too many products. God knows what happens when all those actives are mixing on our skin. There must be some reactions between those chemicals as well, so it's quite a mess, to be honest. So tidying up the skincare, using the skincare that is going to help this particular patient is the first point. Then obviously protecting the skin from the sun, but even looking into hormones and all those things. There are light treatments that are available now. There's a whole range, so we need to start from actually finding the root cause and then guiding the patient through it.
Has inflammation become a bigger concern for patients, would you say, in sort of recent years?
Yes, definitely. And it's difficult. I saw that, I don't know if you would agree, I see more of it post-pandemic, and I'm thinking whether COVID has any, because we know that this is a lot of inflammation of the blood vessels, but the amount of rosacea and the amount of redness I've seen since the pandemic has increased significantly.
Yeah.
So
British dermatologists, I think it's like 50 plus different skin disorders that had appeared post-COVID.
Absolutely.
Really? Wow.
So
And apparently we're all suffering with hay fever so much more, the respiratory sort of conditions.
Exactly. So there's more and more inflammatory diseases, and obviously we, in an aesthetic clinic, we're not able to diagnose it to that level, but we can definitely help to manage it, to prevent it from decreasing.
Products have antioxidants in them, they improve get free radicals, all that kind
Yeah.
of thing. So vitamin C, for example, all of those things can help. But it's just probably pinpointed good diagnosis and working out.
Exactly, getting the right sort of actives into your skincare, and that's why you have to obviously have the conversation with somebody who knows your skin, who's analysed it, and who can prescribe something that's right for you.
Absolutely. Just case by case.
Yeah, as with everything. If there aren't any more questions, then all that's left for me to say is a big thank you to our amazing beauty triangle. And thank you so much to all of you for joining us this morning. I hope it was really helpful and useful. And if you'd like us to introduce you, I mean, I think everyone is very well acquainted in this room now, but you know, we're here if you need us. Enjoy the sunshine. Thank you for joining us. Thank you to Fox Hills for hosting us, and hope to see you again.
Thank you.
Thank you. And don't forget your goodie bags.